When I was a young midwife, my own midwife was arrested and prosecuted for practicing midwifery without a license because we lived in a state where midwifery was heavily prosecuted and there was no licensure for midwives like ourselves. I remember what that was like. I remember having meetings with these wonderful, very gifted, very brilliant people that were very heavily into the political scene of midwifery and trying to formulate a plan of how to change those laws in New York State. I remember how cumbersome it was to change the laws in the state. I remember how heartbreaking it was for all of us who wanted to access midwifery care, and suddenly our access was gone. Hundreds of families were just left stranded. And I remember being in my early 20s and thinking, this has to change. And so over the course of my lifetime, I have been chairperson for our state's licensing board here in New Hampshire. I've been a midwife in an illegal state. I've been a midwife in an illegal state with no licensure and no regulation. And I've been a midwife in a legal and licensable state. And I choose this. And so developing adequate licensure and an adequate board that is peer-driven, that oversees the practice of midwifery, has been a focus of my career since the very beginning, because the only equitable way to oversee a practice of any type of profession is to take people that are like that understand the challenges of the day-to-day work, and make them be competent in overseeing other groups of people that are exactly the same. And so as time went on, I developed a national stance. And so I started working with our national professional organization and was a board member for several years representing New England. And that went through many challenges itself, just as the profession started to change. And I've been a part of the larger midwifery group for 30 years. And so I've watched the definition of midwife go from lay midwife, or, like a completely off the grid type of provider, to something that has a certification and some sort of regulation and association, which are the pillars of adequate professionalism. So I see midwifery as the gold standard for healthy low-risk families, but I also see it as the answer to the maternity care crisis here in this country. We have the most expensive maternity care system that there is in the industrialized world, and we have the worst outcomes. And I don't think very many people understand that the United States is not a pillar of health for their women and their babies. Our outcomes are terrible. They're shameful, and they're getting worse as time is going on. So as they're studying maternal child health care outcomes, they're actually seeing on a national standpoint that midwives with low-risk families in a freestanding birth center actually produce the best outcomes and are the most inexpensive of all the things. And so I'm currently on the NARM board, which is the North American Registry of Midwives, which creates and administers our national certification exam. And so when a midwife goes through a program or a school, they can sit for their boards. The board is the National Association of this group. NARM, it's the NARM board, it's the CPM standard. And so I've been on the board of there for several years now. It's been a life goal of mine to become a member of that board so that I can continue this work for generations to come. And the other piece that I feel very strongly is I'm also on the American Association of Birth Center Foundation, which is a foundation that raises funds to promote birth centers. It gives them startup money, credentialing money, the funds to do research to show the benefits of birth centers, for accreditation grants. So for accreditation, we hold ongoing fundraisers, and every year we have a large gala event that hosts fundraisers. And the money is funneled back into birth center care for all people. I feel very strongly that if we're going to survive the maternity care crisis, that we have to create this as well.